Medical professionals and advocates who work on preventing the spread of HIV in Native communities recently met in Albuquerque, and next week the annual New Mexico HIV Conference will bring doctors, nurses, and community educators together to talk about HIV prevention and treatment in communities across our state. New Mexico in Focus producer Sarah Gustavus sat down with a few leaders in the field to talk about what's working and what more can be done to address HIV and AIDS here in New Mexico.
I'm here at the table today with Dr. Bruce Williams, Medical Director of UNM Truman Health Services. Thanks for being here.
Thanks very much for inviting me.
Martin Walker, an advocate and Director of HIV Prevention for Planned Parenthood of New Mexico. Thanks for joining us.
Thank you for inviting me.
And Ann White, STD HIV AIDS Program Manager for the Albuquerque Area Indian Health Board. Thanks.
Thank you.
Would you like to introduce yourself?
Sure. As a Navajo woman, I would like to introduce myself in my traditional way. So Yate, Sheya Ann White Inishia, Toagdini Nishlankiani Bashishin Nanishtajadashiche, Do Nakai Dashinale. I just said that my name is Ann White. My clans are Water Flows Together people. I'm born for the Towering House clan. And my maternal grandfather are the Zuni clan, and my paternal grandfathers are Mexican.
I'm so glad to have you all with us today. You have such different experience and things to talk about as we look at HIV prevention and treatment here in New Mexico right now. Dr. Williams, why don't you start us off? I understand that the numbers of new HIV infections are staying the same, which some people might say, oh, that's good, but it's not actually a good thing. Tell us why.
It's not good. We have approximately 3,200 people with HIV infected who are in New Mexico, who are living in New Mexico right now. That increases by about 150 per year approximately. It varies from year to year. Remember, every single person who is infected has the potential for infecting others until they're in treatment and their virus is fully suppressed. So we have currently, of that 3,200 patients, approximately half are currently fully engaged in care. Of those, about 80% have their virus fully suppressed. That leaves the other half out there who are potentially expanding the infection to others. We have to do much more to, first of all, engage those folks in care, and then also help New Mexicans around the state protect themselves from getting infected.
We've been dealing with HIV for decades now. People know that this exists. I think a lot of people know that the way to prevent it is to use condoms or to not use needles that other people have used. Why are people still getting infected?
So those are imperfect. Certainly they're great ways of protecting oneself. Condoms break, condoms fall off, condoms sometimes aren't used in the heat of the moment, and that's how people get infected. We know that in pregnancy, for example, condoms only work about 70 to 80% of the time in protecting against pregnancy, so it doesn't take much to think that you're not going to protect against infections. That's not a reason not to use them. There's certainly an important reason to use them. However, that means that they're not perfect and they need to be supplemented with other modalities. Needle exchange, you mentioned, that's interesting. As the governor of Indiana has just discovered, the needle exchange program is extraordinarily important in protecting the health of people. We've had a needle exchange program in New Mexico for over 20 years, and one of the first in the country. And it has been very important in limiting the spread of this disease, plus hepatitis C, as well as other infections to the vulnerable population. So it's been very successful here. But we need to supplement that with other things.
Yeah. And what are people doing in Native communities that's a little bit different to reach out to folks and talk about these issues and talk about how to prevent the spread of HIV?
I think in Native communities, we're still trying to just get the basic information about how HIV is transmitted. Sometimes talking about sex and sexuality can be taboo in some tribal communities, but and I think that's a lot of it's contributed to our Western views that have been imposed upon our people. So we have to reclaim our ways of thinking about sexual health. As a Navajo woman, you know, when a girl enters womanhood, that's celebrated. So our ways of, we've gone to not being willing to talk about sex and sexuality and those types of things. So right now we're just trying to reclaim those those beautiful things about sexuality and trying to educate our people and telling them how HIV is transmitted and that they should use condoms and they should talk to their partners openly about sex.
Is it different if a Native person comes in to talk about this versus someone else from a different community?
Yeah, I mean, I think most communities would like to see someone who looks like them, who can relate to them and can relate to their culture and has an understanding of where that community is and what has happened to that community, to start to have those discussions and talk about sexuality.
Martin, thanks for being here with us today. And you've been living with HIV since 2003. How does that impact how you talk with people about maybe people who are at risk of getting HIV? Does that change the message that you bring to them?
I think it really does. I think I can talk to things about what it's like to live with HIV, and I can give people information about the trials and challenges and obstacles that come with an HIV diagnosis. And I think that hits home a lot of the time. A lot of people that I talk to, a lot of the young people that I talk to especially, and they tell me that if they just knew somebody with HIV, it might change their perspective a little bit. It doesn't really affect their life in a way that they can tangibly talk about. So when they get to actually meet me or get to meet somebody that's living with HIV and talk to us about the disease from an honest, non-judgmental perspective, it's really effective. It seems to be really, really effective.
One of the things right now that's part of the conversation is that people can live pretty healthy lives taking medication for HIV, which is a great thing that people can live a healthy, productive life, but might be making some people think, oh, it's okay, I'll be okay, I can just take medicine. How do you deal with those conversations?
They call it the Magic Johnson effect or Magic Johnson syndrome because Magic Johnson in 1991 or 92 disclosed his HIV diagnosis, and oh, look at Magic Johnson, he went on to go back to the Lakers to win a gold medal in the Olympics. And it should be fine. And then we see all the advertisements for the HIV medications that you see with people rock climbing and mountain climbing and all of this amazing stuff, and you think, oh, well, it must not be that bad. I can just take one pill once a day and it'll be fine. The problem that goes along with that is that there's a whole lot of other things and other parts around your lifestyle that change once you have an HIV diagnosis. In order to be healthy and to be living a healthy and happy life, you change your diet, you take your medications, you are constantly working on and making sure that the rest of your health is being taken care of, and you're always very conservative around sexual risk taking because you don't want to either A, transmit the virus to somebody else, or you don't want to acquire another sexually transmitted infection because having HIV makes you more likely to be acquiring other sexually transmitted infections. So it's a difficult conversation to have with youth about, well, it's not that bad. You just take one pill once a day and you look great. Why would I worry about that? You have to explain the rest of the stuff, the big picture about what comes along with being HIV positive. And that's where you start really talking about stigma and discrimination. And that's another really huge issue right now that we will continue to deal with.
Dr. Williams, how do doctors talk about stigma? That might be part of the conversation as well.
So I think there's many levels of stigma. There's self-stigma. People who are infected believe themselves in some ways, and Martin, you can speak to this better than I, but can feel themselves to be somehow tainted. And we have to help people work through that, to accept HIV as part of their lives, and that they and to realize that if other people are judging them, it's their problem, not the person involved. We also have some stigma unfortunately, among medical professionals still lingering, particularly in some of the rural areas, I think. And much of that's actually driven by a concern that they're going to do people harm. So it's stigma in the sense it's more a fear of doing people harm than it is of exclusion.
Of not having maybe the knowledge to help someone through that diagnosis and get the right treatment.
Now UNM has done a great job in trying to alleviate that problem in New Mexico through a project called Project ECHO, which uses video conferencing technology to link local providers to experts in the field on a weekly video conferencing call, and they present cases anonymously, and everyone learns from that, and that's been very helpful. But there's still, I think, a concern that there's not going to be enough providers down the road because they don't know how to do this, and frankly, For many providers, it's very labor intensive. There's a lot of work that goes into taking care of people with HIV, and Medicare and others have not really stepped up to the plate in terms of reimbursement. So there's been some problems with getting adequate providers in New Mexico. Most of us who do it are getting older, and we need to have new faces.
Are you seeing more young people at your
We
clinic?
are. In fact, that is reflected in the statewide statistics as of the end of 2013, for which the latest statistics are available. There was a 60% increase in the infection among young people ages 13 to 24 over the prior year. And we actually, several years ago, under the leadership of Dr. Michelle Iandiorio, developed a young adult clinic because we saw this trend beginning. And we now currently have about 60 to 70 patients, young people in that clinic. They are very vulnerable, particularly the young gay men, for exactly the reasons you were describing before, both you and Martin, that if I get this, I just take a pill and it's not a problem. In fact, it is a problem medically as well as socially.
Ann and Martin, what does that make you think when you hear that one of our trends in New Mexico is younger people being infected?
So at the health board, we kind of identified that being a population that needed to be targeted. So we just finished up a grant in 2012 that adapted a curriculum for Native youth by Native youth. So it was a 3-year project, and we work with 3 different sites here in New Mexico and also in Texas to adapt an evidence-based curriculum that was on the CDC EBI list. So we took a Latino youth curriculum called Cuidate, and we adapted it for the 3 sites. So we're currently testing that curriculum and sharing that curriculum with a lot of people who are interested in using it to target Native youth and to talk to them about how to protect themselves, sexuality, and also skill building and decision making as well.
What do you want to see next in addressing this issue in New Mexico?
I think that we need to do some really good public health planning and some health planning around how we can go about implementing this really new and novel concept of pre-exposure prophylaxis. It's an amazing new tool that we have for preventing new HIV infection. It goes hand in hand with treatment as prevention, which is another really interesting new concept in the field of HIV prevention, where Dr. Williams was talking earlier about when somebody has HIV and they're taking their medication and their viral load is suppressed, they're much less likely to transmit the virus to somebody else. So therefore, treating is preventing the transmission. But we also have pre-exposure prophylaxis, which is you take one of the medication regimens that's called Truvada every day, and that if you take it every day, is very good at helping to make sure that you don't get HIV. It's only recommended to be used with a full component of prevention intervention, so making sure that somebody's getting tested every 3 months, making sure that they still have plenty of access to condoms. We're still always talking about reducing their risky behaviors, but really it's about another tool that you can put in your toolbox, which just gives you another level of feeling protected. Because like Dr. Williams said, condoms are amazing, but they don't always happen. I mean, studies have shown that most gay men aren't using condoms consistently or correctly. And so we need to make sure that they have some other level of protection, and that's what pre-exposure prophylaxis is going to do, we're hoping. So I think we need to do some really good planning around how that's going to look in New Mexico. So it's not just people who can afford it that get it, but it's available for people across the state who need it.
Dr. Williams, we're needing to wrap up here. Is there a final message that you want to send people in New Mexico about HIV?
Get tested, get care if you're positive, and remember that other things get transmitted sexually besides HIV.
And Ann, do you have a final message?
Just get tested. We offer free rapid testing here in New Mexico, so there's tons of places where you can get tested for free.
Martin?
Get tested and support each other. Get tested is always our message. Get tested. If you know your status, that's half the battle. So get tested and just support each other. Love one another. You know, this is a touchy subject. It can be taboo, but love one another. We're all people.
Thank you so much for being here today.
Thank you.
Thank you very much.